Hello everyone, welcome to my YouTube channel Pathology Learning. I am Dr. Monica. So, we will be starting with the next series, which is inflammation and repair, and the first topic under this series will be acute inflammation. So, what is inflammation? So, we all must have undergone a physical injury or trauma kind of thing, right? Or even an infection. So, what happens after we develop an injury? Initially, we are going to develop some redness and some swelling with pain in that area. And later on, with time, it is going to get healed or cured, and then it will go back to its normal or near normalcy. So, how does this happen? It is because of a protective response called as inflammation. So, normally when there is a injury which is happening, it is going to be removed by the body by a process called as inflammation. So, in medical terminology, we use the term itis as a suffix when we are mentioning inflammation. Suppose there is an inflammation in the meninges, so we will call it as meningitis. Suppose there is inflammation in the joint, we call it as arthritis, and so on. Okay. So, what are the signs of inflammation? How do we know that an inflammation is happening? So, as I mentioned, there will be swelling at the area, which is called as tumor, and there will be redness, which is called as rubor. Then there will be increased heat production also. So, that is called as calor, and dolor, which is pain. Okay. Along with this, there is going to be loss of function of the particular cell which has been injured. So, these signs are termed as the signs of inflammation. The first four, that is rubor, calor, dolor and tumor, were given by a scientist called as Celsius, while the last sign, which is functiolacy or loss of function, was given by Rudolf Virchow. So, these are the signs of inflammation. Moving on, we will see what is the difference between acute and chronic inflammation. So, acute inflammation, as the name suggests, is going to be rapid, immediate response which is going to come into play is the acute inflammation, and it is going to be mediated by the neutrophils. Why? Because neutrophils are the most abundant cells in the WBCs. Also, because neutrophils respond to the inflammatory mediators rapidly than as compared to the other WBCs. So, that is why the acute inflammation is going to be mediated by neutrophils. And this acute inflammation, it is going to be short-lived because the neutrophils, they have very short half-lives, that is 6 hours only. So, after which it is going to die. So, the acute inflammation is going to be self-limited, and there is not going to be much of a tissue injury or fibrosis in acute inflammation. While in chronic inflammation, it is going to be a slow, delayed kind of a response which takes over acute inflammation. That is when acute inflammation is not ending. So, it might progress on to chronic inflammation, or it can occur de novo as such also. So, it will happen when the offending agent is going to be very difficult to eradicate, and the cells which are going to mediate the chronic inflammation will be macrophages, monocytes or lymphocytes. And as the term mentions, it is going to be a progressive or a severe kind of inflammation, because as I mentioned, the chronic inflammation will be directed against those offending agents which are difficult to eradicate, like a environmental antigen, like hypersensitivity reaction or an autoimmune reaction, wherein the body's own immune system is going to attack the self antigens. So, here it is not possible to remove the antigen. So, in that case, chronic inflammation is the major inflammation which takes place. And here it will, since it is a progressive and a severe kind of inflammation, there is going to be some kind of tissue destruction or fibrosis associated in chronic inflammation. Okay. So, moving on, we will see about what are the causes, what are the insights which lead to inflammation. So, starting with infection, any kind of infection, be it a bacterial, fungal, viral infection, any kind of infection is going to be a source of injury. Then foreign bodies like some dust particles, rust particles, or even suture materials which we use in surgeries. So, all of this is foreign to the body. They can be either directly injuring the cells, or it could invite infection over the foreign bodies, and that will again result in the inflammation. Then any kind of tissue necrosis. So, we already in cell injury series, we had seen that necrosis is always associated with inflammation, right? So, the necrotic debris is going to invite the inflammatory cells. Same goes for immune reactions, which I mentioned earlier also, like the environmental agents like pollen grains, which will induce a hypersensitivity reaction, or self-antigens as in an autoimmune reaction. Both of it is going to be associated with chronic inflammation. So what as such happens in inflammation? We deal it with 5 steps. So whenever there was an injury, the body must sense there is an injury. So that is called as recognition. So that there are certain cells like macrophages, epithelial or endothelial cells which are going to figure out there is an where there is an injury happening with the help of certain receptors. So that is the recognition step. After that, the macrophages or the epithelial cells, they are going to send some signals. That is, they are going to call for help from the leukocytes to take care of this offending agent. Okay, so that is what is called as recruitment. They are this happens because they send some signals. So these signals are nothing but inflammatory mediators. They produce these inflammatory mediators and they send them to these WBCs and they call for help. Okay, so that is recruitment. After that, what happens? The WBCs are going to reach the site of the injury and they are going to remove whatever was the offending agent. So that is removal step. After that, what will happen? It has cleared all the offending agent. Now the inflammation has to stop. Otherwise, it will be deleterious to the host cells also. So this termination of the inflammation will happen because of the regulation step. Then once everything is done, the cell has to go back to its normalcy or near normalcy. So that is happening because of cell repair. So we'll be seeing one by one in detail. Starting with acute inflammation, the first step I discussed was recognition. As I mentioned, the macrophages or epithelial or endothelial cells or any kind of mast cells also, they are going to recognize that there is a injury with the help of certain receptors. Like toll-like receptors. Toll-like receptors are nothing but pattern recognition receptors which are usually present on the plasma membrane or in the endosomal vesicles inside the cytoplasm also. So these toll-like receptors are going to be sensing whichever offending agent is present. Suppose a microbe, we'll take an example of a microbe. So they are going to recognize that a microbe has invaded into the body. So they will go on, this toll-like receptors will attach with the microbe and it is going to send some signals, intracellular signals, which are going to trigger the production of inflammatory mediators. Now these inflammatory mediators will be secreted into the environment, which are going to go and recruit the leukocytes for help. So second receptor will be node-like receptors. Node-like receptors are usually intracytoplasmic receptors for recognizing those microbes which are engulfed or which are present intracellularly. Okay. Node-like receptors can also sense certain things which are associated with cell injury. Like when there was a cell injury, there will be nuclear breakdown. So the DNA might be extruded from the cell, or the uric acids which were present in the DNA material might be excluded, or the potassium which was supposed to be inside the cell. So it will be losing into the extracellular membrane because the plasma membrane was destroyed during the cell death. So all of these products are going to come out and these again will be recognized by the node-like receptors. So moving on to the next receptors, which is mannose binding lectins. Mannose binding lectins can bind to the mannose present on the bacterial cell wall and they can trigger the complement system. So that we'll be seeing later. Other receptors like lectins and FC receptors. That is the WBC can recognize the FC portion of the antibody. Suppose the antigen is being attached to the antibody at the FAB site and this is the FC site, right? So now we had seen about the recognition part. Next we will see the acute inflammation, the series of events which are happening in the acute inflammation, that is vascular events and cellular events. So starting with vascular events. The initial step which happens in inflammation is the vascular event. The first step of that is a vascular dilatation, vasodilatation will happen. So normally the vessel wall is of this caliber, now the vessel is going to dilate. Why does it dilate? Because no more amount of blood can flow through that, so that more amount of WBCs can come. So only when the WBCs come, it can get out of the vessel wall and reach the site of offending agent. So that is the reason why vasodilatation happens, and this happens in the arterioles. Okay, and this is going to be mediated by the inflammatory mediator, which is histamine. Other vasoactive amines, the most important one of which is the histamine. Okay, so after vasodilatation, now the vascular permeability is going to get increased. That is, the vessels are just going to become leaky. So why do they become leaky? So that is how the WBCs can exit the blood vessel and enter into the site of injury. The vascular permeability is going to increase in the post-capillary venules. So when vasodilation and increased vascular permeability happens, that is what we perceive as erythema. So we see redness at the site of any inflammation, right? So that is because of this vascular events happening. So we'll see how this vascular permeability increases. There are certain mechanisms by which this vascular permeability increases. The first and the most commonest method is by endothelial contraction. That is, the endothelial cells, normally the endothelial cells are continuous like this, right? So this endothelial cells are going to contract or retract. So this is going to create interendothelial gaps. So through this, the WBCs are going to exit. Since this contraction can happen just like that, it is going to be an immediate kind of response, and since the contraction, if once it has contracted for it to go back to its normalcy, it will take some time. So this response is going to be immediate and transient. Moving on to the next mechanism, which is endothelial injury. So the endothelial cells can be directly injured. The injury can be either a mild injury or a severe injury. Suppose if it was a severe injury, like which that of microbial toxins, or with a physical injury. So all of this will actually cause severe endothelial injury. So whenever the endothelium is going to injured, obviously it is going to be an immediate response. But for the injured endothelial cell to undergo repair, it is going to take some time. So this response will be immediate but a prolonged kind of response. If it was a mild endothelial injury like that of a sunburn. So sunburn, we all know we don't immediately develop it. It takes some time to develop, right? So this kind of response will also injure the endothelium only, but here the response is going to be delayed, and again when the endothelium is injured, it will take some time to repair. So this response is going to be prolonged. Also, the WBCs which are going to exit from this blood vessel, they are also going to come and attach to this endothelial cells, and some kind of injury will be implicated on the endothelium by the WBCs as well. So moving on to the third type of mechanism, which is transcytosis. It is just that the cells are going to pass through the, WBCs are going to pass through the intact endothelium. The endothelium is not injured here. It is just going to pass through it with the help of certain organelles called as vesicular organelles. Okay, we had seen about the mechanisms of vascular permeability and the vascular events which were happening. So what is the result of this increased vascular permeability? The fluid which was present inside the blood vessel along with the WBCs are going to exit from the blood vessel into the extracellular space. So what will happen? The viscosity of the blood inside the blood vessel is going to increase. There is going to be stasis. Okay, so stasis will result in increased viscosity of the blood. So moving on, we had seen about the vascular events, which was the vasodilation, increased vascular permeability and stasis. Now we will see the cellular events which are happening. So now we saw stasis happen in the blood vessels. Normally in the blood vessel, the RBCs are going to be in a central plane, while the WBCs are going to be in a more peripheral location. But with stasis, there is more amount of blood being stagnated at a particular place. So more and more WBCs will occur a peripheral location, and this is what is called as margination. It just appears like a pebble of stones which is present, and this has also been termed as pavementing. So these WBCs which are assuming a more peripheral location towards the endothelium of the blood vessel is what is termed as margination. So the next step is rolling. So the WBCs now will start attached to the endothelium. So this attachment is not so strong. So the WBCs will start attaching and detaching. So this kind of jumping of the WBCs over the endothelium will happen, and that is called as rolling. So why does this happen? Because we had already seen that inflammatory mediators which were released at the site of recognition are going to go and ask for help. So by this time, the inflammatory mediators had come and approached the WBCs and the endothelium. The most important one of which will be TNF alpha and interleukin 1. So these cell mediators will now contact the endothelium and the WBCs. So they will induce certain changes in the WBCs and endothelium. which are nothing but increased amount of cell adhesion molecules. So there will be an increased amount of cell adhesion molecules being expressed by the WBCs and the endothelium. So what are these cell adhesion molecules which are responsible for this rolling? These are nothing but selectins. So we have three selectins: L-selectin, E-selectin and P-selectin. L-selectin is the one which we have in WBCs. L stands for leukocyte. E-selectin is present in endothelium, as the name suggests, E. P-selectin is also present in the endothelium. These P-selectin are normally present in the Weibel pellet bodies inside the endothelium. So L-selectin, we see it is present on the WBCs here, while P-selectin and E-selectin are going to be present on the endothelium. Simultaneously, the ligands, that is, some material has to attach to these receptors, right? So the ligands will be correspondingly expressed. That is, L-selectin is present on the WBCs. So obviously, the ligand for L-selectin will be expressed by the endothelium, while E-selectin and P-selectin are being expressed by the endothelium. So the ligands for P and E-selectin will be expressed by the WBCs. So this kind of attachment is going to happen between the WBCs and the endothelium. Like I mentioned, it is a very low affinity attachment. So that is why the WBCs keep on rolling over the endothelium. The third step is adhesion. That is, there is going to be strong affinity between the WBC and endothelial attachment now, and that is going to again takes place because of some cell adhesion molecules called as integrins. This again is going to be induced by the TNF alpha and the interleukin 1 cell mediators. So integrins are usually present on the WBCs. So we have VLA4, LFA1 and MAC1 integrins present on the WBCs. Now it is going to attach to the corresponding ligands present on the endothelium. That is, VLA4 will attach with VCAM1, which is vascular cell adhesion molecule 1, and LFA1 and MAC1 present on the WBCs are going to attach with the ICAM1, which is intercellular cell adhesion molecule 1 present on the endothelium. So again, this kind of binding between the WBC and endothelium is going to happen, but this time it is going to be a very strong kind of a bond. So now the WBCs had come and attached to the endothelium. What happens next? This WBC has to go out of the vessel wall into the extracellular space to reach the offending agent, right? So that step is called as transmigration or diapedesis. It is nothing but just the passage of this WBCs from the vessel into the extracellular space. And this again is going to be mediated by another cell adhesion molecule called as PCAM1, or it is also called as CD31. This is going to be present in the interendothelial space. So the next step now is chemotaxis. That is, the WBCs have now come out of the blood vessel into the extracellular space. From this extracellular space, it has to reach the site of the offending agent. So this will happen in the direction of the chemotactic gradient. So what are the agents which are inviting this WBCs to the site? So these are called as chemotactic agents. They could be either exogenous or endogenous. Exogenous when the bacterial products, so the bacteria itself will secrete some toxins that is going to invite the WBCs to the site. Or an endogenous products like the chemical mediators, interleukin 8, complement factor 5A and leukotriene B4. So remember this as LIC. This is the most important chemotactic factors for neutrophils. So when these chemotactic agents are being released at the site of injury, these are going to act on the neutrophils and invite them to this place. How does this neutrophil move from that place, from the extracellular space to the site of injury? It is because there will be polymerization of actin at the leading edge of the WBC, while the myosin will be present at the back of the cell. So now this actin is going to throw some pseudopodia kind of extension and it is going to pull the cell. The WBCs is going to move with the polymerization of actin in the direction of the offending agent through the chemical gradient. So this is what we are calling it as chemotaxis. So now we had seen about the vascular and cellular events which happen in acute inflammation, namely the vasodilatation. Starting with the vasodilatation, next was the increase in the vascular permeability, which would ultimately result in stasis. Then the cellular events will happen starting from margination of WBCs, then the rolling, then the addition of the WBCs to the endothelium, then diapedesis, which is the transmigration, Then chemotaxis, wherein the WBCs reach the site of the offending agent. Now the second R, which was the recruitment of the WBCs, had happened. Recognition and recruitment step is done. Now the WBCs has to remove the offending agent. That will happen by a process called as phagocytosis, and about that we will be seeing in the next video. Thank you for listening. If you like my content, consider subscribing and sharing it to your friends who might also benefit from the video. Thank you again.